Millions of children die in the world because they do not have access to life-saving vaccines. And yet, these vaccines are available. The ability to reach these children is absolutely crucial. That is a solvable challenge. My name is Ngozi Okonjo-Iweala, Chair of Gavi, the Vaccine Alliance. A parent should be able to save their child's life by providing them access to life-saving vaccines. That should not depend on where they live in the world. You have children dying of diarrheal diseases when there is a vaccine that can prevent that. You have children dying of bacterial pneumonia when you have the pneumococcal vaccine that can prevent that. You have girls who grow up and get cancer of the cervix. And yet now we have a vaccine, HPV, that can prevent that. We can save these children's lives by providing them life-saving vaccines when they are young. Since its inception in the year 2000, Gavi, the Global Alliance for Vaccines and Immunization, has vaccinated 690 million children and saved 10 million lives. The easy-to-reach children have been reached. And the big problem now is that we need to reach what we call the fifth child, who is harder to access. So that's a huge challenge. Well, one of the things that Gavi is doing is using new technology to reach children, those that are in more remote areas. Zipline is an autonomous drone company that can deliver medicines and vaccines and blood using drones. And they're working now in Rwanda, where you have very difficult hilly terrain, but they can deliver these vaccines to very remote areas in minutes, not even hours, and so lives can be saved. The other thing is the cost of vaccines. We try to negotiate down the cost of these vaccines for people living in poorer countries. I'll give you an example. Pneumococcal vaccine. We've been able to negotiate the price down to about $2.95 compared to what it would be in the US, $100. Can you imagine overcoming this barrier of cost and price? We've come a long way. We've passed the goal of 88% in immunizing children all around the world, and we need to push this as far as we can go. We can solve this problem. Imagine a world where every parent need not worry anymore because their son or daughter has been immunized and will live a long, healthy life and contribute not only to the family but to the country and to the world.